It was 2022. Jen Wolf and her friend were sitting in the audience at a forum, listening to candidates running for governor.
The gubernatorial candidate was talking about disability issues.
Meanwhile, Jen's friend was thinking about another race.
And the person I was with said, well, no one is running against Sandy Salmon, who is also running for Senate.
Sandy Salmon, a Republican, had been in the Iowa House for 10 years. This election, she was running for the Iowa Senate unopposed.
And I made the mistake of going, well, is it too late for someone to run?
Jen imagined someone else running, but her friend turned to her and said,
Jen, you should run.
She wasn't sold. But at lunch with her friends, they got to talking.
I couldn't say no. And it was just, I knew that it was going to be an uphill battle, but the way I looked at it is it was bringing the care issue to a wider audience and maybe to my opponent's attention, so she would pay more attention to it.
Jen has a disability that requires her to use a wheelchair. This posed both a challenge and an opportunity for the campaign.
Advocacy wasn't enough. And there's not enough people like myself, female, mid-50s, single, disabled. I was a healthcare professional, an occupational therapist, with the general intent of not being a politician, but being somebody who really cares about their community and wanting to create positive change.
In partnership with Act Blue, this is Build a Change, a show about the people at the center of progress. I'm your host, Alok Badmenon. I'm an author, poet, actor, advocate, and your companion for this trip around the country. We're in search of the most compelling causes and stories from the candidates, activists, and everyday people driving them forward. Many people think of disabilities through a binary lens, on or off. But disabilities fall on a spectrum, and actually, it's something that we are all likely to experience at some point in our lives, even if it's just temporary. That's why access and care, two core tenets of disability justice, impact everyone, and they also benefit everyone. In this episode, we'll hear from disability advocates who are working to improve representation and make real change for the disability community, and for all of us. Seven years ago, Jen Wolf had her first taste of collective action. She uploaded a call to action video to YouTube to inspire other people to join.
The timing is essential. We go to Washington, D.C. in a week and a half for the Roll on Capitol Hill. The more of you...
She attended the annual Roll on Capitol Hill, a policy and advocacy conference centered around people with disabilities, and specifically wheelchair users.
I'm here to encourage you to share any stories you have about getting a wheelchair or getting repair with Congress and on social media.
And about 75 to 100 wheelchair users would come together. And it was always fun to see that many wheelchair users roll around DC, and having 20 of us trying to get on the metro at the same time. And just watching people watch us, because it's such a cultural shift to see that many wheelchair users together. That was just very fun.
Jen is from Waverly, Iowa. She was in the middle of occupational therapy school when she became physically disabled.
A tumor was discovered in my spinal cord, and so I had to have surgery to remove it, and lost most of my function below the waist. Relearned to walk short distances with crutches, and finished my master's degree. Went back to work for 6 months, and then it started growing again.
Jen went through a second surgery, and then radiation. This time, it resulted in a complete spinal cord injury, and her wheelchair use became full-time. And that brought on new challenges. Things that were once a part of her daily life, like spending time with friends and being out and about, became much more difficult.
And it was time for me to get my first replacement wheelchair. And Medicare said, you only are going to get what you need to get around your home versus what you need in the community.
Jen's insurance wouldn't cover a wheelchair that could help her move around outside and participate in her community. She had what she needed to live, but not to thrive.
And that didn't make any sense to me when we're trying to promote keeping people as active and employed and as healthy as possible. That just made no sense to me, both as an occupational therapist and as a person with a disability.
Which is how she got involved in disability advocacy. She learned to tell her story as a way to drive policy change and help others do the same.
I think when you start telling your story for advocacy, you get ownership over your own story versus somebody else telling it, over it being a pity party, over people feeling sorry for you. It's really saying, I'm owning what's happened to me, and I want to create change because of it.
Iowa Medicaid faced significant criticism since former Governor Terry Branstad privatized it in 2016.
A few years later, when Iowa's governor made the abrupt decision to privatize Medicaid, Jen was at the forefront of the opposition. This shift impacted poor Iowans and people with disabilities the most.
After a state audit found insurers were illegally denying people care, and
the complaints began piling up. People were being denied services illegally, while private insurance companies continued pocketing payments. Wheelchair users were experiencing horrendous wait times for medical equipment repair.
Our insurance doesn't really cover caregiving the way it should. People are ending up in institutions, at least in the disability community, when they really, if they would have 4 to 5 hours of support, they would be able to stay home and potentially work and volunteer and feel like they have more value and be more valued in our communities.
The increasing frustration echoed among Jen's friends, and they turned to Jen for leadership.
I started hearing from my friends, Jen, what can we do? We need to make a change. So we started our own group here in Iowa called Upgrade Medicaid to try to influence changes to policy, knowing that we probably weren't going to change the privatization, but to make improvements at least.
The group started off with 2 days of advocacy.
Please consider joining us for our first major community living and caregiver advocacy day.
A group of caregivers and wheelchair users came together at the Iowa State Capitol in Des Moines. They used their personal stories to advocate for policy change.
The first time we had 13 wheelchair users and caregivers, so we had about 21 folks, and they said that that was probably the biggest amount of physical disability that they'd seen together. The next year, we had 80 people total.
In the mornings, they prepared together, going over the current state of Medicaid policies. They discussed the most effective way to share how they'd been personally impacted by the privatization of Medicaid with their legislators.
So it's really, teaching people how to have relationships with their legislators. And we spent the afternoon writing notes and going up and helping each other talk to our legislators.
But despite all the grassroots advocacy she was doing, Jen felt like there wasn't any real progress with Medicaid or the care crisis in general. She was frustrated. That's when she went to that gubernatorial forum where her friend suggested she run as a candidate for the Iowa Senate. Despite her nerves, Jen agreed it was the best way to raise awareness and push for real change. Now, Jen had to figure out how to campaign, something she'd never done before, while also confronting accessibility barriers and prejudice.
When people first see the wheelchair, the implicit bias is that she isn't either as intelligent or has other deficits or has a poor quality of life. And that's just implicit bias. And I get that because I probably had those before I was in the wheelchair too. So you kind of have to work twice as hard to build credibility.
She came across an online campaign training that was specifically created for people with disabilities. It was created by Sarah Blahovic and Neil Carter, the co-founders of Disability Victory, an organization that aims to equip leaders with disabilities with the skills they need to run for office. Here's Sarah.
So there were no campaign trainings specifically for people with disabilities who, are facing barriers on the campaign trail, both in terms of accessibility and also in terms of stigma and prejudice.
Disability Victory is looking to flip the script on that, teaching candidates how to incorporate their lived experiences and disabilities into their campaign, with the view that it's a strength, not a weakness.
We had 3 of our training programs last fall where we talked about building your brand as a candidate and how to incorporate talking about disability into that, creating a policy platform, and using advocacy within your campaign to affect change even before you are elected to office.
The organization makes sure that accessibility in their training is a top priority. For example, they make sure to have American Sign Language interpretation and provide any training materials ahead of time for people who need time for cognitive processing or who use assistive technologies. Through their work, Sarah and Neil are looking to counter ableism they saw in other campaign programs.
Ableism is something that is really casually ingrained in society. There was another program that had a Q&A page where they were asked, can disabled people be involved in campaigns? And it said yes, as volunteers, where it was not really in the consciousness that disabled people could be campaign staff or candidates.
Which brings us back to Jen. She wanted to run for office because she was tired of constantly having to fend off attacks on her rights and the rights of her community. She spent months connecting with folks and speaking to her experience. As a person with disabilities running for office, she relied heavily on online organizing, but she also got out there and went door to door. These are the kinds of things that Disability Victory prepares candidates for: running an accessible, successful campaign. Election night rolled around. Most of the restaurants in town closed at 9, so Jen and her campaign committee were at a local bar, joined by her close friends and supporters. Her campaign was a long shot. She wasn't expecting much. Still, she was nervous.
Election night, I was much more apprehensive than I thought I would be. The first votes that came in showed that I was doing really well, and that really kind of freaked me out because I wasn't prepared to win. But I got 32%, which for the first run in a very red area, I was not disappointed with that.
So Jen didn't win her first campaign, but she felt like she'd achieved her real goal, making her platform of care and disability justice a core focus of the broader campaign.
We made a dent, and that's kind of what I aimed to do.
Her bold decision gave a voice to many Iowans experiencing the same challenges she was, including privatized Medicaid. While she didn't expect to win, Jen still felt the loss.
You do get a little bit depressed afterwards because you put in a lot of time and a lot of work, and it's I wasn't sure I was going to run for anything again. In fact, I really kind of had decided I wasn't going to.
It takes a toll putting yourself out there. But most candidates lose their first election, especially against an incumbent. And now, Jen's name was out there. She was approached by Waverly's city council representative, Julie Myers, who was looking for a replacement. She wanted Jen to consider running. Jen was apprehensive, not just because she'd lost a long-shot state senate race, but she'd actually been contemplating leaving Waverly altogether. Lately, she was feeling isolated and like she didn't belong.
I wasn't sure I was going to stay in Waverly. I haven't always felt part of my community because of my disability. But it's very isolating being in a wheelchair. You're stuck at home a lot. You can't go visit your friends in their homes. There's some places that you just can't access. Like there's not accessible transportation.
But still, she harbored a deep love for her hometown and the people in it. So, Jen considered the offer to run again for public office.
I started talking about it with my family and in my head, and kind of decided if I can't make change at a state level, that maybe I could try to make some change locally.
So she decided to do it, again. And her previous experience proved helpful, because this time around, campaigning was a lot less stressful. There was less area to cover, door knocking was more doable, and she even recruited her neighbor to help.
He's in his 80s, and he was my door knocker champion. We went out together several times into different areas of town, and he'd go up and knock the door and start conversation and then let me take over. They'd come outside. Unfortunately, the weather was nice enough that they could come outside and talk, and then he'd go across the street and start another conversation. So we were just buzzing around. It was more listening. What's good in the community? What needs to change? And those were my kind of two questions that I went around when we door knocked.
And with each knock, each new conversation, Jen's feelings changed. Running for office opened the door for Jen to reconnect with her local community again.
And I value that piece out of that first run more than anything else.
Election night came. Jen spent the evening at a get-together organized for the mayoral candidate. She was surrounded by other city candidates as they waited for the results to come in.
I was around a lot of supportive folks. It was fun to see things start coming in and still not knowing if you're going to win or not.
The votes kept coming in. And then, the results. Jen was elected as the newest member of Waverly's City Council.
It was a good election. It feels like after several years of being very disappointed about elections, at the local level, it was across the board, we got great people.
Later that night, Jen met up with her friends at a bar and celebrated with a nice, quiet drink.
Of course, my friends are like, "Can you believe it?" And it's kind of a little bit no, but a little bit yes. Just really excited for the new challenge. Now the work kicks in on a totally different level. And it's such a big learning curve. So many things to learn about how a city functions.
After winning the city council campaign, she headed to the store for a new pair of shoes. These ones were special.
I wear Converse Chucks all the time. And I got a pair with pink glitter on it, and I call them my No Place Like Home shoes. And they remind me all the time about how glad I am that I'm staying in my community and trying to make it more accessible.
Wolf? Yes.
This is Jen during Waverly's council meetings. She's now in her first year of office.
Councilperson Wolf.
I will add on top of sidewalks, curb cuts and the handicap or the accessible parking spots and the hatch marks, which just make my life a lot easier.
She's currently working with the Chamber of Commerce to make the city more accessible. In the spring, they will be conducting an accessibility check to see where the city needs improvement and commend the businesses that have made those efforts. One community member who uses a power chair has spoken to Jen about improvements he'd like to see.
He goes all over town all the time. And he really knows the ins and outs of what's working and what's not, and making sure that the town is more walkable or rollable for whoever uses it.
These improvements would benefit many, not just those with disabilities. For example, parents with strollers, kids and rollerblades, or teenagers biking around town. Disability justice can expand access and care for everyone.
We all will deal with a disability at some point in life, more than likely. And it should be normalized.
Jen's story shows us why we need more elected officials who personally understand the challenges of things like navigating Medicaid and Social Security, elected officials who can advocate for the people they serve. But even without representation in place, you can still have your voice heard. Let's talk about the people working to lobby Congress on behalf of disability rights. The summer of 2017 was typically hot and humid in our nation's capital. Despite the heat, members of Congress nearly all donned suits. They were preparing to propose a bill, one that would strip many of the protections in the Affordable Care Act.
It felt very personal. It felt like they were really coming after healthcare. I mean, coming after the healthcare that our children relied on.
That's Elena Hung, the founder of Little Lobbyists, an organization working to advance and protect the rights of medically complex and disabled kids. At the time in 2017, she was a lawyer and a new mom. She was just a few miles away in Maryland at a friend's house. The kids had gone to bed, and the parents stayed up, talking about the news. She was tired of sitting at home. She looked at the other parents sitting with her and decided to make a plan.
It really was this moment of, I would say, hope and desperation that got us to do something.
They decided to talk directly to the people who were set to make a decision that would alter the course of their lives. Elena's daughter, Xiomara, spent the first 5 months of her life in the neonatal unit at the hospital. Then, Elena was able to bring her home with the help of 24-hour care. It was overwhelming, to say the least.
It's a blur. It's a blur. I think my brain has blocked out a lot of it for self-protection. But it was one of the hardest things I had ever gone through.
She needed support. She went looking for other people going through the same thing.
So I went online. I went on Facebook. And basically, if you were in the DC, Maryland, Virginia area circa 2014, and you had a child with a tracheostomy, I think I found you.
She'd found a community of other families, and now they got together to prepare. They wrote out flyers, printed photos, packed their bags, and got on the Red Line to take the metro ride from Maryland to the Capitol building. A few other families drove in, and they convened in the halls of Congress. For most of them, it was their first time on the Hill. They had called in advance to a few offices to reserve time with senators on their staff. They also tried to get additional appointments.
Sometimes we would see members of Congress and we chased them down the hallways.
They were doing all of this so they could get answers to this one big question.
What would happen if our families lost Medicaid, if our families lost the protections of the Affordable Care Act? What would happen to these children?
With this vote, so many of the things she'd relied on to bring her daughter home and keep her alive were up for debate. That included bringing back caps on the amount insurance would cover.
The possibility of that coming back was terrifying to families like mine. Her 5 months in the hospital cost $3 million, which means that had she had a cap on her plan, she would have lost her insurance before she even came home from the hospital.
Elena would have racked up thousands of dollars in debt, and that's not even accounting for the costs after coming home. The round-the-clock home care that allows Elena to work so she can pay for the rest of the family's bills. Another part of the proposal was looking to limit protections for people who have pre-existing conditions.
My daughter has over 10 pre-existing conditions because she's an overachiever like that. So that means that if we were to switch insurance plans for whatever reason, we might not get it because she has pre-existing conditions.
By showing up and telling their stories, they wanted to put faces to the vote that was about to take place. Elena, Xiomara, and other families spent hours meeting with senators and staffers, and still, they didn't even get to all the appointments they made. So they decided to go back a second day. They repeated the process, and again, it felt like it wasn't enough. So they went back again.
Basically, we showed up to every place that we could get to, and we grabbed every microphone that we could get our hands on. And we told our story to anyone who would listen. And we did all of this with our children at our side.
The vote loomed. Elena and the other parents were still stressed, but it felt good to do something. They kept the pressure up. And then, on July 28th, 2017, it was time. Nearly 2 months after Elena first set foot in Capitol Hill, Congress set a date to vote on the healthcare bill.
Mr. Alexander, Ms. Baldwin.
It was nearly 1 a.m.
Mr. Barrasso.
At home, Elena anxiously refreshed her phone.
Bennett.
Things were not looking good.
Mr. Paul. Mr. Perdue.
No. Sorry. Yes.
Thank you. Mr. Peters.
Senator John McCain approaches the podium to vote.
No.
Senator John McCain, in a shocking turn of events, votes against the bill, meaning the healthcare protections Elena and other families relied on were safe for now. Elena felt relieved, but also angry. She was tired of constantly having to be on the defensive.
A child like mine, with complex medical needs, with a tracheostomy on a ventilator, would have been automatically institutionalized years ago. Automatically institutionalized. And what I mean by that is that she would never have had the opportunity to come home to be discharged from the hospital. And in fact, that is still happening in some states today. So in light of that, us applying for Medicaid to get the home care that she needed really meant the difference between whether we got to bring our baby home or not.
And having the care she needed to be at home made all the difference.
So my daughter right now is 9 years old. It's such a joy to watch her grow up and become the person that she's becoming. Getting all teary-eyed because it is emotional.
Elena formally founded Little Lobbyists, an organization that continues the work she and her friends started, lobbying on behalf of medically complex and disabled kids, not only to protect their rights, but to advance them too. Let's support the people and organizations driving disability justice, because disability justice touches nearly every issue, and when it becomes part of policy, we all benefit. Act Blue is here to help you find, support, and even fundraise for the candidates and causes you're passionate about. Learn more about the organizations featured today, Disability Victory and Little Lobbyists, and maybe even how to start your own fundraising journey at actblue.com/buildthechange. This is our final episode this season. Thanks for joining us. Build the Change is created in partnership with Act Blue, produced by Wonder Media Network, and hosted by me, Alok Vadmanan. Our production team includes Edie Allard, Lindsay Cradowell, Sarah Schleet, Abby Delk, Hannah Bottom, and Paloma Moreno Jimenez. Our executive producer is Jenny Kaplan. Our showrunners are Rohida Javangula and Maria Jose Hurtado.